Dr. Monika, on behalf of BestSource Nutrition, I would like to welcome you on this session where the topic is diabetes beyond just sugar. It's about inflammation, stress, and other things.
Thank you so much, Ms. Dipali, for inviting me to this platform to share the knowledge, the little knowledge that I have about diabetes. I did my research on diabetes during my PhD as well as during the master's. So this subject is very, very close to my heart. And I see when India has become the diabetic capital of the world and India housing the maximum number of diabetics on the globe, it becomes very, very important for us to make people aware about how they can manage their sugars better by knowing a little more about about the inflammation, the stress, the topics that we're going to discuss today. I'll come to the topic. I'll come to the question that you have asked me: why blood sugars fluctuate even when people are on the medication? There are many factors which affect the blood sugars. I'll discuss a few of them one by one. The very first would be even when they're taking medication, they are not sure about the accuracy and timing of the dose. Sometimes the dose may get missed. Sometimes the meal timings are irregular, so the dose also becomes irregular. So inconsistent meal timings, they may result in blood sugar fluctuations, and intake of high sugar foods can also affect the blood sugar readings, and intake of caffeine. So, in addition to that, there are few drugs which drug interactions that I'd like to bring here. Steroids, when a person is on steroids, the blood sugars do fluctuate a lot. If a person is on BP medications, then also the blood sugars need to be monitored very, very closely. Let's talk about females, women who are in the menopausal stage or women during pregnancy. The hormones they play a major role in all these situations. So in those cases also the blood sugar needs to be monitored on everyday basis. In fact, meal with every meal, especially in pregnant women, the doctor suggests that blood sugars be taken in just before every meal, morning, lunch, and noon, so that their insulin can be calculated and a dose according to that can be taken. Stress that you've already talked about, stress plays a very, very major role in the in becoming a diabetic, yes, and in the management of diabetes. Because stress directly affects the metabolism of a person, it directly affects our gut brain axis, and then it affects the beta cells of the pancreas, leading for a non diabetic person to become diabetic. In case of illness, if a person is not well, in that case also we see fluctuation despite the person taking medications. Another very important factor that plays a role is sleep. Nowadays, because of high stress and because of hectic work-life schedule, the stress factor has crept in into our life so gradually, and we do not even realize how much stress we are under, even our during our day-to-day routine. A lot of things on to-do list. Then there are a lot of things at the back of the mind. We need to do this also. वो भी miss नहीं होना चाहिए. ये भी करना है. Meetings, deadlines, projects, for people like me who are in a hospital setup, so OPD one after another, and then I need to take care of the IPD as well, and then management meetings, and then sourcing and all of that stuff. So too much, and then women, especially when they have to manage their families as well as the work front, it becomes a little
Absolutely.
too much at a time. So that is when the stress becomes higher and the sleep quality gets affected. So both of the things together, they lead to fluctuations in the blood sugars. The last factor would be physical activity. Most of us are leading a sedentary lifestyle. And even the people who are not sedentary, who are doing some kind of physical activity, they may not be sure of how much and how rigorous their workout has to be. So that again has to be under some guidance, keeping their dosage, the insulin dosage or the medication dosage in view, and looking at their average blood glucose levels during the day. They have to decide about the duration as well as intensity of the workout and the timings, of course. It has to be before the meal time, but then many people they go for their physical activity without eating anything on an empty stomach. So that is where it becomes a little difficult for the person, and one has to take care of this. So these are majorly all the factors which may result in blood sugar fluctuations.
Yeah, and I think I have also experienced that in spite of, taking medication, it becomes effective on a immediate basis, and after some time, if these things are not taken care, then the dosage of diabetic medication also increases
Yes,
gradually.
it does. Diabetes is a progressive disorder. So with the time passing, even the regular dose of medication becomes a little ineffective because of insulin resistance. The body's own beta cells, progressively slow down the secretion of insulin. So that is why these factors become all the more prominent.
Right, right. There's a lot of interest nowadays in the herbs, management of
Yes.
diabetes with the help of herbs. So, do these herbs really help in sugar management?
Yes, we are lucky we are in India, and the knowledge of herbs comes from the ancient Ayurveda. And there are a lot of herbs which do help in not only diabetes management but also in insulin regulation, in reducing the oxidative stress. And but very important thing to know here is that all of these herbs are a support therapy and they cannot replace the medications. I mean, if a person is pre-diabetic, we can still rely on these herbs and look at the parameters after some time, and then get the A1C done to know whether it is actually helping or not. But then every person's body is different, everybody's metabolic response may be different. So all in all, I would say that a support therapy, yes, a very good thing to do, but not as a replacement to the clinical medications. Okay. Here we may discuss a few herbs which are found in India and which are widely used by Indians and abroad as well. Very first thing that we all know is Methi.
Yes.
Yes. So Methi is very commonly known to all of us. So Methi leaves as a vegetable or Methi seeds soaked overnight. They help. They're very rich in fiber and they stimulate the insulin secretion in the body. Even for a person who's got thyroid disorders or who's got any kind of hormonal disbalance, methi can be incorporated as a support therapy. In addition to methi, cinnamon has gained wide knowledge these days. So cinnamon incorporated into diet that also improves insulin sensitivity. So very good for people who are pre-diabetic or who want to avoid diabetes in the longer run. It can be used by them. Karela or bitter melon that we know. Karela is a very good thing to consume by the diabetics. But in case I suggest a person to go for an Ayurveda assessment of the body type because Karela juice may not suit everybody.
Oh, is
I
it?
learned this, yes, I learned this during the course on Ayurvedic nutrition, which I did a few years back. And the therapist told us that Karela juice, the basic nature of Karela juice may not go well for every body type. So it should be consumed, but only under an Ayurveda practitioner. Though
Okay.
it does help, it helps. Karela's got insulin-like proteins which mimic the insulin like protein. So it helps in blood sugar regulation and lowering of the blood sugar. But then, if it suits or not suits, that has to be assessed before taking this. And most of the times, people take it on empty stomach. So that is what needs to be taken care of, right? In addition to this, I can recall Gurmar. Gurmar is another very common plant in India, and as the name suggests, Gurmar. So the leaves of this plant are known to reduce the blood sugar levels and they suppress the taste of sweetness. So the sugar cravings go down and the blood sugars they get regulated. And I have seen people consuming Gurmar on regular basis. Their blood sugars normally remain in the normal range and do not rise. Uh, what more? We have a few more herbs in India. Saptarangi is another herb. which delays carbohydrate digestion in the body. Therefore, it does not, lead to sugar spikes even after a heavy meal. So that is one another very, very important. Giloy is known for giving us immunity, but Giloy also improves insulin sensitivity. So that is also an important herb. Dharu hardra, हरीड़ा बोलते हैं जिसको हिंदी में. So that is also important because this thing inhibits the glucose absorption in the cells, in the blood. So when a meal is getting digested, the digestion slows down. So the spikes in the blood sugar levels, they are avoided. I guess I have included most of the herbs which are commonly found and which are commonly used by the people here.
Yeah, and we are glad that at BestSource Nutrition we have a product called Fit Body Diabetes Care, which mostly have all the herbs which you have just mentioned in a right
So
composition, right proportion. And
yes,
I think that you have also clinically experienced it in your client about BestSource Nutrition's Fit
yes,
Body Diabetes Care. Would you
yes,
like to
I do
share
prescribe.
with us the
Yes.
feedback on
Yes,
this?
I do prescribe Fit Body Diabetes Care from BestSource Nutrition to my clients, and I have seen good results in that. Especially in case of pre-diabetics, they have benefited largely, and their blood sugars have remained largely consistent, and they've been able to avoid medication with by using this product, but only under the supervision of an expert, because every 3 months we need to get A1C checked to know the exact levels. And here the idea is not to avoid medication at all, but to have it only when it is really required.
Right, because these medication itself causes a lot of side effects, and diabetes in itself have leads to lots of complications.
Yes, it does. It does. Yes.
I've seen many dietitians using herbal tea for management of insulin. Do you also using herbal teas in your diet plans? How does they actually function on insulin management?
There are two, three things here I would like to bring about. People are using a lot of juices on empty stomach. For example, Karela juice, they're using aloe vera, Karela, mint, neem, and Giloy. All of these things put into, converted to a juice form and then consumed on an empty stomach. That is one thing which people are doing. For that, I've already discussed. It should be done only and only under the supervision of an Ayurvedic practitioner, so that the body type assessment is done and accordingly the things are consumed, because every herb that we talk about and every food product for that matter has got a particular तासीर बोलते हैं ना उसको, the warmth or the cold nature of the food. So that
Right.
has to be taken care and aligned with the body type,
Okay.
vata pitta and kapha,
Okay.
and according to that. So that is one thing that needs to be done. Uh, Now, when we come to herbal teas, they are a bit safer than those juices taken on an empty stomach. I mainly suggest nettle leaf tea and blue pea flower tea. So these are
Okay.
good for diabetics, and we avoid the side effects by using these teas during the day. So that is when a person has already have had a meal. So after breakfast, before lunch, that is a midday time, or after lunch and before the dinner. So during the evening hours. So having any tea on empty stomach is also something which I do not suggest. But these teas have helped people. Basically, number one is by reducing the oxidative stress in the body, right? Secondly, by increasing the insulin sensitivity, and third, by reducing the hepatic load, by enhancing the hepatic detox. So that is where these teas help the person, and overall the body's agility, the vitality remains intact. So these are
Right.
the two teas which I specifically suggest to people who have got very high A1C. It helps them to reduce their A1C uh, over a shorter duration of time.
Absolutely. In fact, they also help in, management of the certain complications like nettle tea. It helps in managing the complication which diabetes can cause, like what you were saying. Especially in the men, their prostate gets affected over a period of time because of the diabetes. So it helps
Yes.
in managing that the nettle tea, which
Yes, yes,
have
definitely, definitely. The complications do get avoided when these herbs and these teas are, taken on regular basis. So it does happen. It does happen.
and the best thing is that they don't add any calorie. They're the caffeine free herbal teas which do
They
not
are
add any
caffeine free.
calorie to.
Yes, they are caffeine free and they are basically herbal in the sense that they've got a lot of, oxidative stress reduction factors in it. So they help by improving the overall metabolism of the person. They're safe.
Absolutely.
They're safe, Evan.
Right, right, right.
Yes.
So, you have guided us about what are the different dietary foods which one should offer in the case of diabetes, and which are the herbal teas which could be beneficial to be taken under guidance, and an expert can blend it properly in the diet plan of a diabetic person. But these people who are having diabetes, sometimes they have certain daily habits which they are not aware are causing harm to them and causing difficulties in the management of the sugar. So, can you pinpoint on certain daily habits which one should avoid for better sugar management?
I've already discussed a few of the points regarding this for sugar management, for avoiding the spikes in the blood sugar levels. Number one is avoiding sedentary life. To incorporate some kind of physical activity in the body, in the daytime routine. For example, a morning walk may not be a very brisk walk, but yes, a regular routine of a brisk walk and then some exercise during the day. But then the timing should be fixed of the exercise as well as the meal times, right? So, number two is caffeine. I mean, people, because of high stress, they've started taking a lot of tea or coffee during the day, which leads to dehydration in the body and thereby leading to fluctuating blood sugar levels. So that should be avoided. Another third would be whenever they do the exercise, it should not be done very, very rigorous. And if it is rigorous exercise, then they have to take care of their pre-workout and post-workout meal, right? So that can be done. In addition to that, we've talked about herbs and these teas. Excess of it should not be done. They act as a support therapy, but only when they're taken in correct dosage, correct timings, in correct food combinations, and under the expert supervision. Right. So just one consultation with a dietitian or a physician would let them know what is good for the body, and they do help. But a thing taken at a wrong time may would not give the positive result, and in fact lead to some negative. Uh, Another mistake some people do is missing the dose, right? So that should not be done because sugar management has with every meal the blood sugar levels fluctuate. So the meal timings and the medication timing and the physical activity timing. So here timing is the key. There has to be a regular routine which a person should follow. And in that routine also the meal timing should be fixed. More or less, at least the main meal timing should be fixed. The snack and all can at least vary for 15-20 minutes here and there. But the main meal timing should be fixed. Uh, Ignoring the protein intake or the fiber intake in the food. Uh, any main meal should be a combination of all the macros. I've seen people either taking too much of protein in their diets, thinking that we will be avoiding carbs, which will lead to, which will not lead to blood sugar fluctuations. But here, carbs are also important for the body. A diabetic meal plan should have 55% carb and protein according to the body weight, and then fiber, adequate fiber of 25 to 35 gram depending upon age and the weight category that should be incorporated. Healthy fats should be incorporated in the diet in the form of seeds and nuts. uh, Stress, lot of stress we see everywhere around us. Stress management through breathing techniques, through meditation, through some me time in a day, a 10-15 minutes of relaxation, that helps, especially just before sleeping. If a person is into a 10 to 15 minutes of breathing or meditation session, that can help lower the stress levels and lead to a peaceful sleep.
We often
Right?
suggest, chamomile tea as an anti-stress flower tea post dinner. So if you take
Chamomile
that,
tea,
it's a soothing
there's a lot
effect
of
and
research. There's a lot of research which indicates the positive benefit of chamomile tea in case of diabetics.
right.
Yes. So chamomile tea works both ways by reducing stress and for regulating the blood sugar levels. So that is one thing short, I suggested to my patients, the diabetic ones, right? And for not following the dietary guidelines for diabetes, the carb, protein, fat percentages, the meal timings, avoidance of high sugar, high glycemic index foods, that is non-negotiable, that should be done, and avoiding the signals the body gives. For example, an yearly check of eye checkup, right? And if the person is pre-diabetic, then one full body check, a blood test every year. And if a person is in the diabetic range 6.4 plus A1C, then every 6 months one has to get a blood test done. Now, numbness in the tips, there is some jhanjanahat in the nerves, so that should not be avoided, and a person should go to the physician for assessment because diabetes, as I said earlier, it is a progressive disease. It may lead to certain side effects which may not be visible as such, and the if we talk about diabetes itself, the symptoms of diabetes may remain silent for many years. There's a complete body of literature which is available which says that the symptoms do not appear, in some cases, they do not appear immediately. They take some time, and by the time the person feels the symptoms, start feeling polyuria, polyphagia, uh, so by that time, the A1C levels have already gone up and enough beta cells have already got destroyed. So that is a stage where we cannot go into the remission stage. Yes. So I suggest that every person in India, even the children, they should go for their A1C test once a year because diabetes no longer is a disease of the elderly. The age for becoming diabetic is gradually reducing. So even the young people are getting diabetes. People who are in their 30s or 40s, they're also getting type 2 diabetes. I'm not talking about type 1, I'm talking about type 2. So that is one needs to take care of. So yearly medical checkup is non-negotiable.
Right. And what are
And
your
in
suggestions for management of the inflammation? Because that is also one of the hidden cause of irregular sugar in the blood.
inflammation becomes evident through blood tests. So high CRP levels, high TLC levels, they are a direct indicator that there is some inflammation on the body. So if a person is getting their blood test yearly, they will get to know there is inflammation. To reduce the inflammation, dietary guidelines need to be followed. The stress needs to be kept very, very low. Physical exercise has to be enough to help your body and not too excess to raise the inflammation levels. And then these herbs, they do help in reducing the inflammation.
Yeah, that is wonderful advice given by you, Dr. Monica. I'm sure everybody will get benefit from these advices and suggestions you have given about the food a diabetic person should take. And I'm so grateful. I'm so thankful to you for sparing time for us and giving our thoughts on the important subject like diabetes. Thank you so much for being with us. Any last few words which you want to say about Best Source Nutrition as a brand?
I'd like to say two things. One thing about the brand and one thing about diabetes. Even if a person is non-diabetic, go for the blood test done, especially the people who've got a family history of diabetes. So if the parent is any one of the parent, or even if the parents are non-diabetic, but diabetes has been there in the previous generation. So the person should go for a diabetes profile test. And BestSource Nutrition has very, very good and pure supplements. And the best thing I like about them is those small packets. The packets are not very huge, so small quantities can be bought. And the effectiveness I have seen in my patients, wherever I have suggested your supplements, I have seen positive results in my patients who have used the supplements. So I would recommend it to people who would want to, who would want to look at authentic product and effective product.
Thank you so much. It is great motivation for us to keep coming up with such kind of products which could be used to the people and to the dietetics community as well. Thank you so
Yes.
much for sparing time with us. Thank
Thank
you,
you
ma'am.
so much for inviting me to the platform.
Dr.